Dr. Pavlakis, a lot of kids in school seem to be daydreaming and not focusing. The teachers are concerned. Maybe the kid has some kind of a focusing problem. What's that all about?
Well, there is such a thing as attention deficit disorder, with or without hyperactivity. And these are children that have problems with concentration, distractibility, impulsivity, and they may be hyperactive as well. They don't have to be. The boys that have it are more likely to be hyperactive. Girls are less likely to be hyperactive.
What's the ratio between boy and girl?
I don't know the exact number, but I think it's 2 to 1 or 3 to 1. Boys more commonly have it than girls. It's also probably underdiagnosed in girls. One of the problems with this whole condition is that the teachers worry about it if the kid's hyperactive because they're disrupting the class, and that's not necessarily something that we're all worried about. It's really the teacher's problem in that situation. Whereas you might have a child that sits there and is inattentive and doesn't learn anything, and the teacher doesn't worry about that child because the child's not disruptive. And that child is actually one that we don't want to miss, because that child might be the one that's truly falling behind.
How can we diagnose? Is there any tests we can do?
What ADHD is, just in general, it's usually a genetic condition. These children tend to be disorganized, tend to be felt to be immature. And the key thing to know about ADHD is it does and can get better as you get older. It's an immaturity of attention. And that's really what it should be looked at. It's not really a disease as such, but it's an immaturity of concentration where your concentration improves.
Is there any written test that can get it?
And what we do is we can do tests for it. There are several ways of diagnosing it. One way is by a standard scale that has been validated. Sometimes parents look at this and say, well, this is ridiculous, but it does work, where we give a scale that's a checkoff list to the parents and to the teachers, and we can score that scale and make a diagnosis that way.
Is there a name for this test?
There are different tests. There's a Connors, which is most commonly used. There's a Vanderbilt. There's also a SNAP form that I tend to like. This is generally the way we diagnose.